There are a few events that occur post nerve injury that can occur due to any reason. So, first the nerve degenerates as soon as it is injured and later it regenerates. This is an important point that you have to remember. So, as soon as the nerve is injured, it will first degenerate, then it will regenerate. Now, depending on the side on which these changes occur, that is degeneration or regeneration, they are classified broadly as changes distal to the injury and changes proximal to the injury. However, the changes of regeneration do not have any specific names, but those for degeneration do. The changes that occur distal to the site of injury are called secondary degeneration or Wallerian degeneration. Right? Wallerian degeneration is the degeneration that occurs distal to the site of injury, and proximal to the site of injury, this is called primary degeneration or retrograde degeneration. Right. Now, let's look at this degeneration in detail. Now, we have just seen that based on the side on which the degeneration occurs to the nerve injury, it can be secondary or Wallerian and primary or retrograde. Coming to Wallerian degeneration, it occurs within 24 hours of the injury. What happens here is, first the axon will degenerate, followed by the degeneration of the myelin sheath that surrounds the axon. So, first there is axonal degeneration within 24 hours, that is followed by myelin degeneration. What happens in axonal degeneration? The entire cylinder of the axon, that is axon along with the endoneurium, breaks into small rodlets. Right? This is degeneration of axon. Coming to myelin degeneration, there is lipid hydrolysis of the myelin sheath. Myelin sheath undergoes lipid hydrolysis and forms tiny lipid droplets. Now, all this debris is collected by Schwann cells. Okay, however, one point here is that neurolemma is intact, and the Schwann cells and macrophages, they collect the debris and result in the formation of ghost tubes. Because they contain the degenerated material, they appear as hollow tubes, and hence these are called as ghost tubes. So that is the process of degeneration, that is Wallerian degeneration. Now let's look at primary degeneration or retrograde degeneration. Right? These changes occur in the proximal fragment only up to the first node of Ranvier. Right? Up to the first node of Ranvier, we call it as the retrograde degeneration. What are the changes here? The cell body shows swelling, and typically, usually, if this is your nerve cell, in a normal nerve cell, it is central in location, the nucleus. But when it is undergoing degeneration, it goes to the periphery. Especially, it is opposite to the axon hillock. Right. The next change is chromatolysis. That is nothing but breakdown of the Nissel's granules. Right? This is the most important sign that you will see on histology. Breakdown of Nissel's granules. This is termed as chromatolysis. And there is disappearance of the cell organelles, mainly Golgi apparatus and the neurofibrils. Now, an important point that you have to note here is both this retrograde as well as Wallerian degeneration occur only in the types of nerve injury which are termed as axonotmesis and neurotmesis. We learn about these in detail in a bit. For now, please remember that this degeneration occurs only in axonotmesis and neurotmesis, and it is not present in neuropraxia. There is no anatomic disruption occurring in neuropraxia at all. Right? Now, let's get back to regeneration. We have seen that it is seen in both proximal and distal fragments, and it occurs about 90 hours after the injury has taken place. So, the changes which occur distal to the site of injury are axon recovery, that occurs at a rate of 1 millimeter per day. Please try to remember these numbers. Regeneration, it occurs after 90 hours of injury, and the rate of axon recovery is about 1 to 3 millimeters per day, right? Then another important sign over here is the positive Tinel sign and the motor march. We'll learn what are these. Now, before going to that, let's look at the changes proximal to the injury. There is reappearance of the Nissel's granules, neurofibrils and Golgi apparatus. We have seen that these undergo chromatolysis and these absolutely disappear, and all of these will reappear when the nerve cell is regenerating, and the cell will regain its normal cell body and nucleus. Right. Now, let's look at this Tinel's sign and motor march in detail. Elicitation of Tinel sign is used to check the recovery of the nerve fiber. Is used to test whether the nerve is regenerating or not. So, how do you test it? On gentle pressure over the nerve on the skin of the patient from its distal end to the proximal end, the patient will experience a tingling sensation. This is present only if the nerve is regenerating. Right? The tingling sensation is experienced only if the nerve is regenerating, and this we will term as positive Tinel's sign. Okay, this tingling sensation, which is an indication of regeneration, is a positive Tinel's sign and it's a sign of recovery. Now, what is motor march? It is nothing but the nearest muscle to the injury recovers first, followed by the other muscles. That is, the order of recovery goes from proximal to distal. All the muscles will not recover at once. One after the other, they keep on recovering. This phenomenon is termed as motor march, and this is characteristically seen only in axonotmesis, right? And not in neurotmesis. Only axonotmesis shows motor march. Now, let's quickly look at types of classification of nerve injury. So, the first type of classification we'll be looking at is the Seddon's classification. It classifies nerve injuries into three names that we have just seen. The first one is neuropraxia, next is axonotmesis, and the third is neurotmesis. The severity of injury keeps on increasing from neuropraxia to neurotmesis. So, the injury type is temporary in neuropraxia, moderate in axonotmesis, and there is a complete transection of the nerve fiber. That is the most severe type of nerve injury. Right. The axonal damage you can easily understand. Neuropraxia, the axon is completely preserved, whereas in axonotmesis there is disruption of the axons and myelin, but it involves all the units. Neurotmesis involves all the units. There is disruption of the nerve fiber. And degeneration, we have already seen there is no degeneration in neuropraxia. Positive Tinel sign, we have seen it is only present in axonotmesis, and there is complete degeneration in neurotmesis. Recovery, complete recovery, obviously in neuropraxia. Spontaneous recovery, it takes some time in axonotmesis, and because there is complete degeneration over here, absolutely no recovery in neurotmesis. Let's look at the examples of such kind of injury. For neuropraxia, it is crutch palsy and tourniquet palsy. For axonotmesis, it's a closed fracture and dislocations. For neurotmesis, it is an open wound. So, the second type of classification of nerve injury is the Sunderland's classification. It's basically grading, more of a grading than a classification. And grade 1, it is the most common type of nerve injury. It occurs due to ischemia and is a transient loss of function. There is only a transient loss of function in this type of injury, right? There is no anatomical disruption. Grade 2 is a prolonged or severe pressure to the nerve resulting in death of axon locally or distally. Grade 3 includes an interruption of the endoneural tubes. Grade 4, what happens is the fascicles become disorganized, and in grade 5 you can easily understand this will be the complete transection of the nerve fibers. This is the Sunderland's classification.